All right, here to discuss is Dr. Perry Wilson. He's an associate professor of medicine at the Yale University School of Medicine. And his article, Testing Could Help End the Pandemic If Only We Had Tests, it was published this week. Doctor, thanks so much for being with us. First, let's just start with the update on these tests coming out. You can get 4 per household in the first phase, but they'll ship 7 to 12 days after you order them. Your thoughts?
Right. So, well, hey, it's a good start. So credit where credit is due. It's good to see this. But of course, these are tests that you're going to need to get in advance. You need to have them in your house when you start developing symptoms so that you can test rapidly. So this isn't the kind of thing that you can get quickly when you're traveling, when you feel symptomatic, or when you might be visiting someone vulnerable. So I recommend everyone, when the website opens, try to sign up, try to get them sent out.
Dr. Wilson, isn't another big issue whether or not these tests are reliable? I think every single one of us and everyone watching right now probably has some story of someone, a friend or a family, who was exhibiting symptoms, had an exposure, took one of the rapid at-home tests, and it came back negative.
Yeah. So we're starting to learn exactly how these tests are best used. And for those at-home tests in particular, when the Omicron variant came, it became clear that people have infection and may even be infectious, able to transmit to other people for several days before those tests turn positive. So they're not a great early indicator of infection. What they're really great for, though, is once they turn positive, following the result to see when you are no longer infectious, when they're negative again. That would have been a great criteria to leave isolation for people who had COVID-19. The CDC didn't add that criteria, and I think, frankly, they didn't add that criteria because there simply weren't enough tests to allow people to do that. Hopefully that's starting to change. But yeah, we need to use the tests in the proper way.
Do you think that we're relying too much on the PCR tests and we should focus more on the rapid at-home antigen tests?
Well, they each have their use. So, as I said, those antigen tests are great to tell you when you're sort of done, when you can leave isolation. That's the ideal use case for them. The PCR tests are great to detect the disease early, before the antigen tests turn positive. Now, there's a problem there, too. Testing is so backlogged right now that for many people, they're getting the PCR test, they're not getting results for 4 to 5 days later. So, sure, it can tell that you were infected, earlier in the course of your disease, but if you only find out 4 to 5 days from then, the public health impact is quite minimal. So we really need to work on that testing infrastructure so that you can get results quickly, so that if you are infected, you can protect people around you.
And I mean, you wrote this piece basically that we might be able to test our way out of this pandemic, but how would that work?
Well, the idea is we need to slow the spread of the disease. And the number one thing that we've focused on for much of this pandemic has been vaccination, which has been incredibly successful. There are breakthrough infections with Omicron, but vaccines, even with the advent of the Omicron variant, are quite protective against severe disease and death. That is a success story. But we're honestly maxing out how much benefit we can get out of vaccines. The way you slow viral spread at this point is by taking people who are infected and preventing them, to the extent that they are able and willing, from spreading it to other people. And the number one way you can do that is just letting them know they're infected, especially with vaccinated people with breakthrough infections who might be minimally symptomatic. We need to be able to tell them, oh yeah, you're infectious, you'll be fine, but why don't you stay home for a few days while the infection clears, so that you don't infect someone who's vulnerable.
Dr. Perry Wilson, really helpful information. Thank you.